Good afternoon, everyone. It's wonderful to see all your faces. And on behalf of the Executive Council of the Association of Senior and Emeritus Faculty, I would like to welcome you to our second virtual at ASEF Luncheon Lecture. Today, we are privileged to have three leaders of the Alliance of Minority Physicians. The AMP was established in 2012 in an effort to strengthen faculty diversion and inclusion throughout the Penn medicine community. These efforts are geared toward underrepresented faculty, house staff, and medical students at UPHS, CHOP, and the School of Medicine. Dr. George Dalembert is an assistant professor of clinical pediatrics at the School of Medicine. He is the associate director for the pediatric residency program at CHOP and is an alumnus of the National Clinical Scholars Program Fellowship. Dr. Dalembert is faculty co-lead for the AMP. Dr. Jessica Fowler is assistant professor of anesthesia and critical care at CHOP in the Perelman School of Medicine. She has served on the executive leadership team of the Alliance of Minority Physicians since its founding and oversees the Penn Visiting Clerkship Program for underrepresented medical students. And my longtime colleague, Dr. Iris Reyes, is professor of clinical emergency medicine at the Perelman School of Medicine. And it's so nice to see you again.
Nice to see you.
Her areas of expertise include cultural competency in healthcare and diversity in medical education and training. She has served our institution in so many capacities and importantly, has been integral in the development of the curriculum embracing cultural competency at the medical school. She is the founder of the Alliance of Minority Physicians and is a faculty advisor for AMP. And now it is my pleasure to turn the floor over to Dr. Dalembert.
I'm actually going to be starting.
That's
quite all right. Thank you all. It's so great to see so many familiar faces here, and thank you so much for inviting us to present to the Society of Emeritus Faculty. I know that we have a lot of work ahead of us with regards to diversity and inclusion, but I wanted, it's important for you all to know the work that's actually being undertaken now through our organization. Next slide. I just want to take a moment, today being Veterans Day, to take a brief moment to thank all the veterans out there for all of their sacrifices. I worked last night. And I took care of a Vietnam veteran. He'd served in Vietnam for 3 years as a Navy corpsman. And I could have talked to him for hours about all of his experiences. And he's one of our West Philadelphia citizens. And it was just extraordinary having a brief interaction with him and knowing that there's so many out there who have given all and are still giving for our country. So thank you all. Next slide. So essentially, you're going to be hearing about what AMP is all about. I'll come back in a bit to discuss some particulars, but I'm going to turn the conversation over to George. George, you're muted.
Thank you. Good morning, everyone. We wanted to start with just a little bit of the why behind what we do. And at the heart of it is this idea: ensuring diversity in the healthcare workforce is in the nation's compelling interest. And if you don't want to take our word for it, you don't have to. The Institute of Medicine, back when it was the Institute of Medicine, also stated this as kind of the highlight of this landmark report from 2004. They highlighted that the United States is rapidly becoming a more diverse nation, but the representation of many of the racial and ethnic groups in health professions is actually far below the representation in the general population. That trend has unfortunately persisted over the last 15 years. To give a better sense of what the current state is, this pie chart here depicts the percentage of all active physicians by race and ethnicity. It's data from the AAMC, their diversity in medicine data, and it's the most recent data from 2018. You can see the breakdown there. There's that big slice of orange, which are white physicians who make up the majority of active physicians at 56.2%. not listed here is that male physicians are about 64% of active physicians. And you can see that it's much smaller slices of the pie for all of the other groups noted. So how does this compare to the US population overall? On this table here, just to kind of help visualize the scope of the problem, you can see that there are considerable differences in the percent of active physicians compared to US population. And for example, if you look at Black or African American individuals who comprise 12.5% of the US population, they are about 5% of the US physician workforce, which is about 40% of the number of Black physicians that you might expect for their general representation. But why does this actually matter? You might be thinking, like, what are the benefits of a diverse workforce? Why is this a goal that we should have? The report from the IOM came out in 2004, but it wasn't actually new news. It's always nice to have it codified in one place. We have a lot of data to support the findings that ensuring diversity in healthcare workforce is in our interest. So there's a diverse array of benefits to workforce diversity. One of which is kind of the category of access. Thinking about minority patients in particular, access is improved when physicians are from URM backgrounds, so underrepresented medicine backgrounds. Those physicians tend to serve more underserved communities and treat a greater number of racial ethnic minorities, Medicaid patients, uninsured patients. You can also think about outcomes and be it cardiovascular outcomes, diabetes, other outcomes. A more diverse workforce helps to actually see improvements at the patient level. And as we think about being institutions that deliver quality care, equity is a key part of quality, according to the IHI. And so seeking to deliver equity in our care means that we should be thinking about all the various factors that come into play. There are education benefits as well. A diverse workforce helps to ensure that students and trainees really learn the cultural humility that is key to effective care. And also there's data to show that campus diversity experiences are associated with gains for all students' learning outcomes, as well as their community involvement. And then if you just want to think about it kind of like from the bottom line, just thinking about the business case for it, for those business-minded folks out there, a diverse workforce is actually associated with more favorable patient perception of care, increased satisfaction of care. That's more referrals for your bottom line. If just kind of like the moral justification for having a diverse workforce isn't enough for you, there's some dollars and cents in there as well. Right, so diversity is a strength for an institution, but what helps us to turn it from an aspiration really into a reality? A review of the literature reveals several themes in terms of what has been implemented and what's been proven to promote the success of a diverse workforce and to diversify a workforce. Some of those factors include having robust invested mentorship for people of various levels, pipeline investment. We'll talk a little bit more about what the pipeline is. Having strong institutional leadership that helps us set a climate that shows that you truly value diversity, you value inclusion, and work to actually achieve those goals. Professional development programs are also a key to success of these groups. And then it's also just important to have a community in a peer network, people who can understand what you're going through, who you can reach out to and rely on in those inevitable tough days. And so given this list of all these things that help and the gap that's noted and the need for it, we really wanted to do something about it. So enter the Alliance of Minority Physicians.
So I take over here. So back in, I've Judy, as Judy mentioned, I've worn many hats at Penn over my 31 years now, actually, as part of the faculty. I spent many years working at the medical school as an advisory dean, as interacting as faculty advisor for the Latino Medical Student Association. And I saw that there was actually a support network for minority medical students that had been in place. It was a fairly strong support network. And as I started hearing more about the push for improving diversity in our health system, it dawned on me that there was a glaring need for a support system for resident trainees and fellows. Having gone through the training process, I knew how isolating it was to be a person of color. And I really felt strongly that there should be a support system in place. So about 2011, I actually started to kind of set the framework for the Alliance of Minority Physicians. I happened to be in a situation where I had a meeting with President Gutman, and I pitched it to her, and she strongly supported it. And then I pitched it to Dean Jamieson, who also strongly supported it. And then I got to work, and I really wanted it to be a resident-driven organization. If this was, they had skin in the game, this was something that was important for them to help me design an organization that was going to be to their benefit and supporting their progress through their training and ongoing career. And so I reached out to every person, minority resident that I could find to ask if they were interested in, and was very blessed in having just an extraordinary group. Jess Fowler, who you'll be hearing from shortly, was one of the first who answered the call, and we spent about a year actually putting this together and designing a framework for what we wanted the Alliance of Minority Physicians to be. And so you'll hear about that in just a little bit. You'll have more details about what we are doing. And I made it, I wanted to include both CHOP and Penn Medicine, the School of Medicine. Again, the faculty kind of spread across both institutions, and I didn't want to really just be an isolated entity at Penn Medicine. So it's really all the Penn Medicine hospitals. Right now it's predominantly Presbyterian, HUP, and Pennsylvania Hospital, all the residents from there, and the CHOP residents as well. And then we also expand out to faculty, and the medical students are included in the programs that we put together. Next slide. So this is our membership. We have, in this fiscal year, we have, let's see, I can give you the hard numbers. We have over 100 medical students. There are 190 residents across both institutions that are members of AMP, 78 fellows, and 258 attendings, 222 of which are on faculty. So we started off small. We had our first welcome reception in 2012. There were 3 new minority residents that joined us that year. And I think we did virtual this year, obviously. The year before that, we had over 45 that had joined us. So our numbers are growing. The programs are actually working to recruit minority residents and fellows to our training programs. These are incredibly talented individuals. And I'm just delighted that these programs are working. Next slide. So this is our motto: strength through diversity to better the health of the patients we serve. I mean, really, the patients are ultimately our focus. This is why we went into medicine. This is the one thing that joins us across all specialties, all our job descriptions, and the better we serve our patients, this is our goal of our institution, is really to provide outstanding healthcare, and it's the motto of our organization. So how do we realize this mission? I'm going to turn this over to Jess Fowler to give you some details.
Thank you all. Excited to share with you today something that I think for all 3 of us and the others who are part of the leadership of AMP has been really, I think, a life mission in different phases, and has been great to sort of realize and see the needle move here at Penn and at CHOP. And this idea of strength through diversity to better the health of the patients we serve, I think there's a lot of nice ideas about what it means to be and create a diverse culture, and one where we're really keen on inviting individuals to be a part of that and to grow in that and to lead in that. But without sort of a strategic plan and actual action items, we don't really move from idea to realization. So we'll take you through a little bit of how we do the work that we do in the Alliance of Minority Physicians. Next slide. So there's this idea of a framework for success. And so if you can imagine with this group back to whenever it was that you first decided to be a physician. And I was actually talking with a friend about this yesterday, and I had a Black pediatrician named Dr. Mary Tillman. She was a graduate of Howard University's College of Medicine. And so for me, from the outset, the example that I had to take me from this sort of pre-med, which really we know starts long before individuals enter college, to actually the realization of becoming a physician. There was a bit of an example I had. I had someone who looked like me, who was sort of a stalwart and someone I could hold at the head. But then actually navigating that process and knowing the steps to take can be very challenging and difficult. And we know that particularly for those from underrepresented backgrounds in medicine, not having examples, not having individuals to walk you through what you need to be competitive at each level can definitely be a challenge. We know that the interests in STEM are not as robust as they should be in backgrounds where kids are coming from places that are underserved. And I think we could each tell you about the stories we hear from pre-medical students and medical students, pre-medical students who are often discouraged from sort of the realization of the dream they want because maybe they don't fit a mold or someone hasn't even seen the example for them. And so this idea of recruit, retain, and reaffirm is really important. Recruit, meaning being intentional about going out and finding individuals who are talented, finding individuals who we know would really be a huge addition to our community of learners here at Penn and at CHOP. Retain, what's the culture, what's the environment that we create such that they want to complete their training, such that they're supported. We know that Penn and CHOP offer incredible resources, but to be honest, those resources in and of themselves are not always enough to make someone feel like this is an environment that is for them and that is supporting them. And then reaffirm, letting people know that it matters that they're here, that there's value that they add in being here. And we would believe that all of these elements are really important to move someone from a pre-med who has a dream of becoming a doctor to actually going on to become a senior faculty member here. Next slide. And so the way that we do this, the Alliance of Minority Physicians, is through a couple of different areas of programming that you'll see circled. And so we'll talk about these in details, but it really is about making sure people have a home and a bit of a family, we use that word a lot, of other individuals who look like them and who support them. And this grows across disciplines, across divisions and departments, so that people know that there's someone that they can look to for support, for guidance, and for mentorship. It's making sure that they have the tools that they need to be successful at every level as they sort of navigate from, let's say, where they're starting as a medical student onto what it looks like to matriculate into residency and fellowship programs and then onto faculty. And it's making sure that we sort of, I think, stick to the core of what's so important for, I think, so many of us probably on this call, and I think often a particular passion for a lot of our URMs, which is what's the impact that we're having, not just at the bedside, but on the community at large. Next slide. And so I'll pass this over to George, and we'll sort of go through each of the elements of exactly how we make this work.
So Jess talked about our AMP family, and we really do see this group of medical students through senior faculty as part of one big family. But when you have a family this big, it's really important to keep in touch. And so we do that through a few different venues. One is just a quarterly newsletter that highlights recent events, upcoming events, opportunities, for example, for funding that people might be able to use to apply to the work that they're doing. We also have a website, allianceofminorityphysicians.org, where we also post information. Right now, we're building out just based off of some recent interactions. We're building out just kind of a listing of like the pre-medical opportunities available at Penn. We also developed some kind of like anti-racism compilation of resources there as well, and just really trying to make that website a resource that people can go to. And then we're also active on social media. Our handle on all platforms is amp_UPHS CHOP. We encourage you to follow us. It's okay to be on your phone for this one moment of the talk if you're going to go ahead and add us on Instagram and Twitter. And we try to give shout outs to our AMP family So we have our Amplify initiative, which really just tries to highlight the amazing work that is being done in research, in community advocacy, in just kind of patient care, in just leadership by so many of our members, and just using those platforms to be a voice, an excited voice and cheerleader, and also to kind of highlight important ideas that need to be discussed. And we're very lucky and appreciative to have a good following on our social media platforms, including Kevin B. Mahoney, who some of you might know as the CEO of the Penn Health Systems. So this is one retweet from earlier this year where he just kind of like appreciated the work that AMP was doing in combating microaggressions. And we really try to use these platforms to further the dialogue that's so closely tied to the overall work that we're doing.
I think one of the important things to know is that, you know, for those of us who are here at Penn and CHOP, we understand sort of the benefits of being a part of this community. But to be honest, some of the knowledge of our institutions is not necessarily associated with a history of being welcoming. And so I say this because I think that being intentional about our recruitment and intentional about our outreach is incredibly important. And so one of the ways that we do this is our participation in both local, regional, and national conferences through the Student National Medical Association and the Latino Medical Student Association. And both of these organizations are really comprised of underrepresented medical students from around the country who are looking really for guidance, obviously trying to matriculate through medical school to be successful, but then there are opportunities for them to interact with residency programs. Every year, we spend time actually traveling. We send residents, fellows, and some faculty members out to engage with students to answer their questions about our institutions. And I think in addition to sort of showcasing what we offer at CHOP and Penn, it's also been a great opportunity for mentoring relationships to develop. So I can tell you that probably 2 years ago, when the SNMA held their national meeting here in Philadelphia, I was there, critical care attending, and had a person that I knew from a past conference come up to me and say, hey, you really need to meet this individual. They're interested in the PICU. They're up at Boston. And I said, that's great. Somebody from Boston Children's. We always love to take from them. And got to meet an individual named Cody. And he is now one of our first year fellows, and actually only the second Black male that we have trained in critical care at CHOP. And so these relationships really do make a difference and they matter. And I think we could tell you tons and tons of stories about that, where we're actually getting to go and I think honestly shift the narrative of sort of the ivory tower, that's some perspective that some people have about who we are as Penn and who we are as CHOP. It's an opportunity to tell people that there's a place for them here and that it actually matters that they come, that we think that they would do well here. And we can tell you that there are individuals who have heard from their past mentors that CHOP and Penn are not the kind of place where they should be. And I think it's helpful for them to see their faces reflected in the individuals that we go out and have recruit, and then really longitudinal relationships that get formed over time. In addition to our conference recruitment, we obviously have the opportunity to discuss, meet with, and really promote medical students as they're applying for residency and then residents as they're applying for fellowship in our programs. And so we do this with partnering with the GME, both at CHOP and at Penn, both at HUP as well as at Pennsylvania Hospital. And we do this in a couple of ways. There's some outreach that goes as programs sort of let us know who in their applicant pool are URMs. We have the opportunity to sort of introduce ourselves up front. And I think that that's really important for a student who's trying to figure out where they're going to go for residency or a resident looking for fellowship to know early on, hey, there's a community for me here. There's people that are already ready to look out for me. I was reminded, we have a recent video that we won't show today, but encourage you to go to the website and watch. And one of our PEDS residents, who actually was one of our visiting clerkship students, talked about the fact that, you know, work in diversity and equity and inclusion is something he's been excited about for a long time. And it made a difference to come to an institution where there's already the groundwork laid for that to be happening. And so it's really exciting for us to get to tell individuals interviewing for surgery and OBGYN and pediatrics, hey, there's a family here waiting to invite you to come and be a part of it. This year, in the midst of sort of virtual work that was going on, we pivoted a little bit and we've actually held a couple of sessions for medical students over the summer, over through a variety of specialties. We've been holding sessions for fellow applicants. And so we did 2 different sessions outreaching to over 40 fellows across HUP who are interviewing in a number of different specialties to sort of showcase the community we had and share it with them. And then we actually have our 3rd of 3 sessions for fellows from URI backgrounds who are applying to CHOP. And what we've heard over and over again is, a lot of people put diversity on their website. A lot of people say it matters, but you all are really showing it. And it's evident that this is something that's a priority for you. Additionally, once folks are here, we want them to be successful and to do well. And so professional development is another huge part of the work that we do. And so there are sessions that we held led by Dr. Kanisha Campbell, who's an associate professor in pediatrics and attending in adolescent medicine, really a 3-year curriculum that spans a variety of workshops, whether that's how to prepare to present at a conference, how to navigate the job market, how to get the most out of a mentoring relationship. And it's great because we have the opportunity for our residents and fellows to interface, and our medical students to interface with leaders from across Penn and CHOP. They get to develop some sort of personal relationships and meet people they might not otherwise meet. But again, it's sort of a nice complement to the obviously robust clinical and research training that they're already getting as a part of our institutions. And then, we talk a lot about the pipeline, and Penn, the School of Medicine, Perelman School of Medicine does an incredible job of recruiting a diverse group of students. And I will share sort of anecdotally that around the time that I first came and when Iris was first starting AMP, there were some shifts in the School of Medicine that actually really dipped our retention numbers for Penn medical students actually staying in our training programs. I think it was as low as 1 to 2 students out of a group of at least 30 to 40 who actually stayed on at Penn and CHOP. To become trainees. And so obviously it was important for us to say, you know what, we've got to reach back. It's great for us to reach out to students across the country, but if we're not taking care of the ones who are our own, then we've sort of missed the boat. And so we have very specific programming, including our mentoring, workshops that we do, interfacing, sort of preparing folks for the clinical work that they'll do. There's a particular session called our minority mentoring sessions and cracking the clerkships, which Reyes started actually before the founding of AMP, where students, just before they go into their clerkship rotations, get the chance to hear from residents and faculty from every specialty that they'll rotate in. Hey, here's how to be successful. Here are the things to watch out for. And we know that that's important because, some of the biases that individuals hold, whether that's us as faculty continuing to learn or other individuals who are part of the clinical learning environment, we want to be sure that our students are able to navigate that well. We also want to be sure that they know that the family we have for them on the other side of medical school is something that they can take advantage of and be a part of.
Perhaps one of the biggest themes that you see when you do a literature review of the factors necessary to engender success is the importance of mentorship. And so we have a built out part of our programming that is focused on just that. We implement vertical and horizontal mentoring. So that means that we have a med student in a group, a resident in a group, a fellow, junior faculty, senior faculty, so that they can each tell the person who's at that stage prior to theirs about how to succeed. Like, what are the tips that they can pass on? What are the tricks to kind of make sure that you can make it to that next stage? But in addition, we also have horizontal mentoring. And so that means that you can talk to another resident as a resident yourself, or another junior faculty person, and have a near peer mentor who can really share what it's like to be in that grind with you, who maybe just was dealing with what you're dealing with the week prior, and can really walk you through how they got through it, how you might got through it, or just to give you an ear and just to appreciate in a real way what you're going through. That combination of the vertical and horizontal approach, I think, really adds a robustness to the mentoring relationships. And part of what we also do is we build these families out longitudinally. So you get to know these people over time, and we try to match people kind of based off their interests, but not necessarily just everybody from the same specialty. We use it as a means of really expanding the network of individuals that people know and really can rely on and reach out to and collaborate with in really creative ways. And on top of that foundation, we layer on an actual curriculum, which is also longitudinal, which deals with important topics, just kind of like how to be a good mentee, how to be a good mentor, topics like microaggressions, imposter syndrome, and then you get to hear from other people in your family and across families about what they've gone through and how they navigate some of those topics and incorporate that into your own kind of like practice. And in the end, we end up with a product that's a family that you can connect with, that you can reach out to with any questions or for just kind of like support when you're having those inevitable rough days. In addition, we just build in other social and networking events. So we have two kind of annual events that are the centerpieces of our calendars. One is the annual House Staff Welcome Reception, which usually happens in August of every year. It's an opportunity to really bring together the entire AMP family and welcome the newest members of our family. So we welcome the new residents, we welcome the new fellows, we welcome the new faculty, and to welcome them, we have kind of some of that institutional leadership that was mentioned as an important component. We have the CMO there, we have the physicians and chiefs there, we have department chairs, division heads that take the time out of their schedule, that they take the time out of their evenings to, back in the day, be present, but this past year to be on Zoom and to really show that this is something that is worth their time. That they are passionate about, and that messaging is really just a reflection of the broader support that they give us kind of like throughout the year and have done so for many years now. We also have our annual graduation gala, which serves as the bookend and kind of like balances our welcome reception. So in that, we congratulate our family members on all of their accomplishments over their training. And for a lot of them, we welcome them as new fellows, as new faculty, as they transition from their previous roles. But we also, for some folks, it serves as a celebration of them going out and going back home or going to their next stage in some other location, but knowing that they will always have this AMP family that they can reach out to, that they can reach back to. And I think that's been especially nice recently, just to have people who have graduated, who are reaching out from like Texas saying like, hey, like, what are you guys doing over there? I miss you guys. Just having that connection, especially as everything's going on right now, and knowing that those connections really transcend just the time that you're here. We build those connections not just in those big events, but also in kind of like smaller things where you get to know each other, happy hours, bowling, potlucks. And then we also try to collaborate with other Penn graduate and professional student organizations. So the dental school and their students, Wharton, the law school, the Black Graduate Student Association, and others to really kind of build networks so that the future physician leaders of America can get to know the future legal leaders of America, and like maybe down the line we can all collaborate to achieve those same equitable goals that we have in common. In addition, we also engage in community outreach, and this, I think, really is an opportunity for people to get involved in what drives them a lot to medicine at times. In addition to just the patient care, it's caring about the communities that we're in. So two initiatives that we have had recently are just based on food insecurity, and that we grounded in the community health needs assessment and the evaluation for Philadelphia, especially West Philadelphia and Southwest Philadelphia, of high levels of food insecurity. And so we have partnered with social work as well as a few different departments across Penn and CHOP to connect to the Farm to Families program, which is run at the St. Christopher's Foundation for Children. It helps to bring fresh fruits and vegetables to families in our local food deserts. Your life is worth Penn Medicine, but your health depends on a complex system of policies and regulation that require civic engagement. And to that end, we have partnered. We partnered in the past few months with Vote ER, which is a nonpartisan nonprofit organization, and really tried to help to encourage people to get out there, vote, to use their voice. And to kind of have their say with our elected officials, so that they can have some kind of impact on their health. And so there were health democracy toolkits that allowed providers to help get their patients registered. And this is an example of one of those badges that had like a nice little QR code that you can scan to make sure that people were registered, to check their registration information. And we kind of rolled this out. It was in our email signature for several months. So any email that we sent out, we were even passively encouraging people to go ahead and engage in their civic duties.
And so as we sort of reflect on 2020 overall, these are some of the founding things that you've seen. And I think the programming that we've had over the last several years has allowed us to sort of pivot and adjust and hopefully continually improve to meet the needs of our house staff. And I think that one of the huge parts of that was really this year. We can go to the next slide. And we talk a lot in this nation about the sort of confrontation of two pandemics, one that we've known since our founding as a nation, and the other which really hit hard this year in 2020. And so as COVID-19 picked up and we saw it sort of, I think, opened the eyes of many to the disparities that some of us knew already existed in terms of the health outcomes and the communities that COVID was impacting. We also saw sort of a more public view of police brutality, of the killings of Black and Brown individuals. And so seeing these things come together, I think really we knew that it was a shock to the system, I think, for our nation, and found that, as a family, you want to care well for your family members. And so it was really an opportunity for us to think about how to ensure that our house staff, our faculty, and our medical students really felt supported. One of the adjustments that had to be made as they were on the front lines caring for individuals. And then also as they were sort of processing what was going on in our nation, and even most recently in our own backyard in West Philadelphia, to know how to sort of be encouraged, be cared for, maintain their wellness, but also have spaces where they can sort of discuss this. And I think that President Amy Gutmann has set really a wonderful precedent for us at Penn overall in sort of her leadership in addressing these things head on. And I think that as the Alliance of Minority Physicians, particularly the faculty, coming together to make sure that we were caring for our house staff and making sure that we were sort of thinking about how we could continue to partner with the institution as a whole and move it forward, there are a couple of action steps that were taken. You can go to the next slide. So a group of individuals sort of came together and started to have conversations about, there's a lot that's going on, and with, Ahmaud Arbery, Breonna Taylor, George Floyd, and others, these stories and the lives and that were impacted, people wanted to be sure that what they were feeling was really known by a larger community. And there were a group of individuals, a few of us, that came together to sort of write a letter to the leadership of both the Penn Health System, the Penn School of Medicine, and CHOP, and say, hey, this is what a large group of us are feeling. This is what we're facing. And this is not only what we need from our institution, but this is actually the difference that we can start to make. What a great opportunity for us to be even more intentional about our focus on diversity, equity, inclusion, and to actually take steps to try to shift that. And so what you see here is a letter that went out in June that was signed by about 130 Black and Latinx faculty from across different specialties, and really inviting a conversation and a partnership with our institutional leaders to say, hey, we think that in light of everything that's going on, this is a real opportunity for us to have some change. As you all know, that the Office of Inclusion and Diversity right after this time also started the ACT initiative that has been ongoing. And so it's been a nice partnership with other leaders actually from this letter coming out to start to take steps to really see what are the changes that we can make in our institutions to showcase, I think, our real commitment to this work. And so from that, a lot of different things were sort of pointed out as recommendations. And there were sort of three main domains that this fell in from AMP. One was fostering ongoing authentic dialogue about race, racism, and anti-Blackness, and what that looked like in terms of educational spaces that existed and where we needed to maybe make those conversations more robust and in the forefront. The second was to eliminate longstanding institutional racism at Penn and CHOP. And I think this varies from what employees at every level experience to what was actually happening for our patients and our families. And the third was partnering with community leaders and organizations to tackle deeply entrenched structural barriers impeding the health of West and Southwest Philadelphia's Black communities. So here we are, sort of a stalwart of excellence and talent housed right in the middle of a community that has a lot of need. And so have we really been doing our part to ensure that, that our neighbors are well cared for, not just when they come into our hospitals or into our clinics, but are we really caring for every aspect of their lives? What we've seen come out from this work has actually been incredible. As you guys may know, the sort of clinical practice on the Penn side, CPUP, has actually started an anti-racism task force. And this was one of the recommendations that came from that letter. And they're currently working on a 5-year strategic plan to really look at what are the metrics we need to follow, what are sort of the cultural shifts and accountability things that need to be set in place, and led by really conversations that happened with Dr. Driscoll and others to say, hey, what can we do that's going to look at our clinical environment as a whole to make sure that we're taking really active steps in being anti-racist and truly inclusive and equitable in the care that we provide. Dr. Florencia Pollitt, who's the chief of the Division of General Obstetrics and Gynecology, has been our AMP liaison to that work. And there are a number of individuals who, from what we've heard, have been having very productive conversations in moving this forward. Similar work is paralleling at CHOP with some reworking of some of the diversity councils that exist in an anti-racism sort of working group that will be happening on that side. And I think really the response of leadership across all of our institutions has demonstrated the real commitment, I think, to these issues. Additionally, you know, in order to continue to create space for folks to dialogue about this, that letter came out of something that we started this year called AMP Family Dialogues. And it's just creating a space for people to come together, really in a virtual format, much like we're on right now, to talk about the issues that they're dealing with, to have a space to vent, to have a space to heal, to have a space to be encouraged. For the first set of these that we had back in May into June, we had one with faculty and one with house staff, where we just got to talk about sort of what people have been feeling, how they've been coping, and get some education on what it means to deal with traumatic and toxic stress, with sort of images that people had seen, experiences that they have had, or even conversations that they have been privy to while at work. And then how do you sort of maintain your wellness? How can you be sure that you're getting the support that you need? And this has been, I think, a great space for people to come together as we've continued to do these, to have a space to dialogue about things. It's also been a nice complement to some of the larger efforts that have been now added within Penn through the behavioral health sort of team support, as well as sort of Penn employee support. And I think has been, again, a great space for people to come together. When we talk about, are you in an environment that can care for you well? Yes, you're in an environment that can train you well. Yes, there's opportunities for mentorship. Yes, you're going to get great clinical exposure, but where are the spaces where you can sort of process what's going on? And I think that these family dialogues have been a huge part of that. And so really with that work and the programming that we've had, I'll turn it over to Iris to talk a little bit about, you know, sort of what are the next steps that we're thinking about and as we look ahead for the Alliance of Minority Physicians.
So before we move on to next steps, I want to just mention, you know, that how grateful we are for the support of the leadership at both institutions. Madam Bell, Kevin Mahoney, Dean Jameson. I mean, they've been there for anytime we've asked them to join us, and not only with you know, sort of emotional support, but certainly with funding. So we couldn't gotten this far with all the things that we've accomplished without support from the leadership. And I just want to say we're really incredibly grateful for that. We are looking to grow. We are looking to continue what we're doing, but certainly we're looking to grow. And I'm going to turn it over to George. One of the things that we're looking to expand on is really the faculty arm of AMP. Again, this was designed to focus on residents and fellows, our trainees, but we feel like there should be an arm that really addresses faculty needs. So I'm going to turn it over to George to talk about that a little bit.
So this is kind of a new initiative and expanded focus that is born out of what we were hearing from our membership, especially in those dialogues, especially over the past few months. It just became kind of clear that as much as we were trying to stay focused on that initial group that kind of Iris had initiated, there was that gap in support for. There were still ways in which this community, especially now as robust as it is, could support our faculty. So Iris and Lisa Walk, who is one of our geriatricians and chief of that division, are going to be co-directing and co-leading this effort. And the goal is really for it to be an additive effort. It is not meant to replace or reinvent ongoing efforts. We really want to complement what is available. And again, just kind of always focusing on our membership and what in addition we can offer them. So a focus on promoting minority faculty in particular, and what other services might be helpful to them, thinking about what is counted when you're going up for promotion, and making sure that the work that minority faculty maybe disproportionately do compared to their non-minority colleagues is also supported and recognized as important and as worthy of going into what's considered for their promotions, and then making sure that we also offer opportunities such as maybe like mock appointment promotions committees, so that people can practice kind of like going through the different topics that they need to be able to cover and things that they need to be able to speak to, or developing other opportunities for faculty to just kind of build that regional or national reputation, depending on your stage of promotion that you need to get to that next level. So we have a group that's actively thinking about what those next steps might look like. So as we look ahead, I think that we want to make sure that AMP's voice is at the table. And so we will continue to advocate. That means being a champion, being a supporter, being a promoter for our trainees, for our faculty, and at the end of the day, for our patients. And like Ira said, we can't say enough how grateful we've been for the partnership of the leadership of the health systems in really moving this work forward. They have invited us to the table as an important constituent and have really made us feel like valued collaborators. They not only give their support in words, they give their support in their time and their money, and they really follow up in action what they profess to believe in and hold dear. And so it's really nice to have that partnership with them as we continue to move some of these initiatives forward. And at the end of the day, I think that we will just continue to be committed to having iterative refinement and adaptation. John Lewis once said, change often takes time. It rarely happens all at once. That has definitely been the case with a lot of this work. I'm only seeing a small sliver of it. Iris has seen decades more than I have. And many institutions are just at the beginning of their journey to finding their strength. To be sure, here at Penn, there are departments and divisions who are at different stages of their journey as well. There have been an incredible number of new initiatives dedicated to kind of principles of diversity, equity, inclusion, anti-racism. However, without action, like the statements of solidarity and establishing committees, it kind of risks being an exercise in just kind of like diversity and anti-racism theater. We are really committed to kind of lasting, enduring, real change. And we've been at this work for almost 10 years now. And though we have responded to recent events, our core efforts are not in response to those events. We've done a lot in the past decade, and the next 10 years look even brighter. So looking ahead, we want to ensure that we continue to optimize our ability to better the health of the patients we serve, and we will continue to do that by finding the strength in our diversity.
And please go to our website. There's a fabulous recruitment video that just launched in the last couple of weeks, and you can find the link at our website. You'll hear directly from some of our trainees about their experiences with our organization. Thank you all.
Well, just going to jump in here. Am I being heard by everybody?
Yes.
Yes.
Yeah, it's Judy Aronchik. All I can say is, wow, that was enlightening and inspiring and overwhelming to me. So thank you. Thank you for an amazing presentation. And it really makes me feel wonderful to know that our administration is partnering with you and backing you and supporting you. And I'm just wondering if I've been retired for 5 years, so I don't know how much your message and your presence permeates to the faculty at large, but everybody needs to hear from you, everybody. Anyway, so we're going to open this up to questions, and you should all have the feature on your iPad or your computer to raise your hand. So if you have a question for any of the panel, just raise your hand and Karen will acknowledge you. And thank you again.
We do have a question here from Dr. Veazey. What do you think are the most important challenges for us to increase URMs in CE and tenure track?
I mean, I'm happy to take that on. I mean, I think it was Jess that mentioned that, you know, the talented trainees that are out there in our country need to know that this is a receptive and welcoming environment. You know, having gone through the promotion process at Penn, it was extraordinarily painful. It wasn't transparent at all. It was, you know, it's certainly gotten better. But I think that, you know, we need to recruit the talent that's out there. I mean, we're just starting to see the numbers of minority faculty that are entering into the CE and tenure tracks are just ever so slightly starting to grow now, but we need to nurture that, and we certainly need to recruit, and we need to show them that we're invested in that process. I think, you know, the other thing that hasn't been addressed is the minority tax that many of us of color have had to pay. And a lot of our faculty are dealing with that now. I mean, one of the issues that comes up whenever we have our family discussion sessions is, how do I get my research done while I'm also trying to promote something that's near and dear to my heart, like diversity. And you know, it's my answer is always like, you got to get promoted. You have to focus on your research, but by the same token, then the work isn't being done in order to extend, you know, to pay it forward for those that are following us, to give them a helping hand so that they can launch their careers as well. So I think that now there's definitely a spotlight on the issue, and I think that certainly the recruitment part is just starting to develop, and then the supportive part, and then certainly recognizing the price that House staff of color pay and faculty of color pay in order to really to improve diversity in our institution needs to be fully recognized in the promotion process. That part is not valued as yet. Again, when particularly our research and CE track faculty are coming up for promotion, the diversity work just doesn't really count, essentially. So that part I think needs to change.
I would add to that, Iris. I think that's spot on. I think there's a difference in saying, hey, we want people here, and then intentionally recruiting. I think the other part of that, especially when I think about the CE and tenure track, is what mentorship looks like. And so I can just think off the top of my head of about 3 CE Black female, you know, research academic physicians who've left over the last couple of years. And one of the challenges for them was getting the support and mentorship that they needed to continue to be successful. And they've gone places where they've just had more explicit support for individuals who believe in the work that they are doing, and who have said, we will do whatever it takes to get you there. And sometimes I think it's not a lack of mentorship and support unintentionally, it's just not being actually intentional about it. So, right. and that could be because of either shared interest, that can be because of comfort in the conversations that are had, that can be in sort of similar backgrounds that have come up. We definitely see a difference in those who I often joke and say sort of are homegrown, so who've come through the system versus those who are coming from outside the system. And I think all of those things need to be sort of taken into account and some really intentional steps taken towards that. I think the other thing is that, it wasn't until a couple of years ago, at least in larger ways, that we've actually talked about what those numbers look like. And so I think divisions, leaderships of divisions and departments need to see, wow, look at how different this is within my group. And now I need to put actually some concerted effort to understanding why and actually doing something about it.
Thank you.
Thank you. We have a few more in the chat. In academic medicine, faculty and trainee education curriculum around racism, anti-racism are typically separate and distinct. Are there efforts to share curricula or to share learning values?
Yeah, I think that that's a great question. Thank you, Doreen, for that one. With like my medical education hat on, I think that we are at different stages of developing curriculum for those topics and are actively doing so and thinking about how do we kind of best train the next generation of physicians. That being said, there is, I think it's important to acknowledge there is often a disconnect between the faculty development that is also happening at the same time that is necessary to kind of like support the transformation that we want in our workforce as we think about these topics and translate our learnings into action. I think a lot of the foundational work is similar and can be done in similar ways, but part of what's also important in this is having opportunities to reach people at their levels and to speak to things that are particularly relevant to them. And so that's where maybe some of the foundational work could be done the same, but then some of that next level work, it's going to be a little bit different for a resident to talk about what their experience is and what their challenges are. And it's useful to have some of those spaces for them to kind of discuss and grow and have those discussions at the resident level, thinking thoughtfully about how to bridge it so that they are able to have conversations with their faculty, with their attendings, that they're able to be upstanders instead of just bystanders and feel like they have the space to do that and know that their faculty will like back them up in challenging situations. So all that to say, I think that there's a lot of work to be done there. I think we're just getting started at doing it, at least in our department, and that probably varies largely across the institution as to where different groups are in terms of just a small amount of work, let alone linking work that's going on. There was a centralized effort through the Center for Health Equity Advancement to kind of like put together some of those foundational materials, and that had started even last year or a year and a half ago. But I do think that that's a great opportunity for the university to put together its resources to increase those offerings.
Yeah. And I'll add briefly, I want to get to that next question, but for Doreen's point, I think that one of the discussion points that has come up as there's been energy around what does sort of education in these spaces look like is to try to not make it completely separate. So I think you do need probably some spaces where there's dedicated time to talk about things, but I know in critical care, I know within the pediatric residency program, and I know that this is happening already in some of the surgical grand rounds, is what are the spaces we already have for education? And how do we make this just a part of the discussion that happens? So I'll give you an example. We had a journal club where we talked about sort of COVID racial disparate outcomes. And so there was a lot of conversation in a very research-focused topic that we would normally have, but pulling in issues related to racism and to health disparities. And so I think that there also needs to be sort of intentional effort to say, this isn't separate and apart from what we do. This is a part, just as you have to learn how to like take a history and a physical, right? In medical school, we say, hey, it's important for you to understand the patient's whole story. And so I think we've got to be intentional about how we weave that into the fabric of education that already exists, because it's part of how we take care of one another and take care of patients.
And if we have time, we have one more here. Is there a formal way for departments that aren't very diverse to engage AMP to help with recruiting minorities, since we might look very appealing right now?
Absolutely. I'll I'll take on part of what we've done. And so we didn't talk about this a ton, but the Penn Visiting Clerkship Program invites fourth-year medical students from all over the country to come and spend a month with us. And one of the things that we definitely found on the CHOP side was, if you're a little bit worried about how we are, what our culture is, if you come and spend time with us, then you realize all the resources, the great people that are here. And I think the same has been said for Penn programs. And what we've seen is when these students come and spend time, I think it does two things. One, it allows, well, a couple of things. One, it allows a student to sort of get the sense that, wow, I can be successful here and this is where I want to be. Two, I think just the fact that this program is offered, and these are funded clerkships. So we give students, actually, we pay for their travel and their housing while they're here. The fact that a department or division is willing to put money forward, I think, is again a sort of tangible demonstration of their commitment to diversity, equity, and inclusion. Three, I think it actually kind of reshapes the focus of, let's say, those who are usually on the selection committee. They're used to seeing people from a certain pedigree and from a certain institution. And now not only they can actually work side by side with someone, and I think have that scope. And again, it's not necessarily an intentionally small lens, but can take the time to sort of open that up and say, wow, this was a really great student who did a great job, who I want to be here. And then I think the other sort of unintended consequence that's to our benefit is when those students come and have a great experience here, they actually go back to their institutions and talk to their friends and say, hey, Penn and CHOP are the place you want to be. They have a community of people there. They have mentors available. They have great facilities. I saw people that looked like me working and being successful. And so I think that that's one of sort of a very tangible way. And we definitely have seen, for example, plastic surgery recruited their first Black female trainee through the visiting clerkship program. OBGYN at HUP has matched students through this program for the last couple of years. And so I think for departments or divisions that are looking for a way, I think that is one way. We also have a number of other sort of efforts that we do in going out and recruiting, and would be glad to sort of do a consult or partner with a department or division in looking at how they can be more intentional with their recruitment efforts.
Well, I think we've answered the questions, and I just want to thank the three of you, George, Jess, and Iris, again for just a phenomenal presentation. This was just a wonderful experience for all of us. So thank you, and thank you all for joining.
Thank you.
Thank you for having
Thank
us.
you for having us.
Bye-bye.
Pleasure.
Thank you.
Bye.
Bye.